Welcome back to The Secret Files, a podcast series sponsored by Cutera. In the first installment of this three-part series, we heard from experts who explained what the secret RF fractional radio frequency, or RF microneedling system is. Cutera gathered thought leaders to discuss the new technology and its applications, and now they discuss why they have integrated this secret RF system into their practices. For Dr. Ashish Bhatia, what sets secret RF apart is its versatility.
So we've had an opportunity to play with a lot of different devices, and one of the things that I really liked about the secret RF was its versatility. It really gives you kind of all of the options. There's a large tip and a small tip, the 64 pin and the 25 pin tip, and so typically we use the larger tip on the body so we can cover larger areas quickly. The 25 pin lets me kind of get into very delicate areas very easily, such as near the eyelids and around the nose and that type of thing.
Dr. Bhatia is an associate professor of clinical dermatology at Northwestern University in Chicago, and also in private practice at Oak Dermatology.
The other thing I really like is the needles on these tips. The option of picking the semi-insulated needles or the non-insulated needle gives me the option of being able to deliver energy just deep, or to be able to deliver energy from the dermal junction all the way down. And so that's another thing I've really liked. The needles also move very smoothly because they have a coating on them that helps them glide through the tissue with a little less resistance. And so what that does is it kind of minimizes the damage and the destruction to the epidermis and dermis from the mechanical forces. And I think that is one thing that really leads to more quick recovery and less downtime. That being said, it has a very high energy range, so we can alter the energy settings tremendously. And then we can adjust the depth of the needle to 1/10 of a millimeter, going from 0.5 millimeters all the way to 3.5 millimeters. And so I like personally having that really wide range of choices. And so I can use it as a tool that is totally customizable to exactly what I'm treating, whether it's the delicate skin around the eyelids or if I'm really getting deep and down into acne scars. And so the customizability of the treatment for the patient is really one of the things that I think makes the secret RF stand out.
Dr. Bhatia co-moderated the conversation with Dr. Jeffrey Su, who is co-founder of Oak Dermatology with Dr. Bhatia. He is also a clinical assistant professor at the University of Illinois, Chicago. Dr. Su posed a question to Dr. Douglas Fife about his decision to choose secret RF. Dr. Fife is founder of Avita Dermatology in Las Vegas and is an associate faculty in the Department of Plastic Surgery at the University of Nevada.
Doug, what do you think? What made you decide on the secret RF versus other devices?
Like Ashish, I like the versatility of the device, how you can adjust it and you can do a more ablative or semi-ablative treatment or a totally non-ablative treatment with the semi-insulated tips. The main thing for me also was the speed of the treatments. I mean, Cutera has designed this machine to do a very efficient treatment where you can do a whole face in really not that much time, like 15 or 20 minutes. We can cover a whole face with a really aggressive treatment, and the topical anesthetic doesn't wear off on one side while you're doing the other side. So basically, speed and versatility.
Absolutely. I think I hate to keep repeating what both of your messages, but I think versatility is the word I would use to describe, and the advantage of this device over other devices out there. You can basically customize every single parameter on this device. You can adjust the tip size, the needle depth, the intensity of the energy, the pulse duration, insulated versus non-insulated needles, such that you can basically treat anybody that walks into the office, regardless of skin color, and targeting basically most of the skin issues that they will be presenting. So this is the kind of versatility and customizability that is matched in the industry. But I think what would be very interesting now is for us to go around and have everyone tell everyone else, what is your one favorite treatment with a secret RF? Is it scars? Is it stretch marks? Is it pan facial treatment? And what is your pearl when you perform this treatment?
Dr. Su asked Dr. Adriana Holly to weigh in first. She is the owner and medical director of the Center for Advanced Dermatology in Phoenix, Arizona.
Well, my favorite treatment, I guess, is the panfacial, but I specifically focus on the eyes. The Secret is the best device in my hands anyway for getting rid of those lines that are just out of those kind of crow's feet that are just out of reach of the toxins. And so I'm able to completely obliterate those. And I'm doing very well also on the perioral lines. And so I'm very excited about that. I also have had some good success with necks and with jowls. And so I'm excited about the potential. I think that basically I treat at different levels. And by understanding the anatomy of the skin, the thickness of the skin, as everyone has said before, you're able to tailor the depth of treatment to exactly where the problem is. And so I focus on that. Some pearls is that I guess I have special aftercare. My kind of philosophy is sort of from the inside out as well as from the outside in. And so I also supplement with a specific topical product that helps, that has studies in wound healing. And so that helps the patients. And then I also suggest that they try an oral supplement called Juven that helps to build collagen, and that is one of the Ensure products actually, and it's available at CVS or on Amazon. And I'll give them 1 or 2 packets to try when they leave, and I hope that that enhances the results that we see with the device.
Funny, Adrian, you said that because I'm starting to recommend Juven to my patients as well. Anytime when I'm do any procedures that may involve collagen production, and I do feel that it makes sense for some of these patients to take this supplement, especially in some of my older patients where their collagen generating machinery may be slowing down a little bit. So we want to give them every advantage that we possibly can. What about you, Manu? What's your favorite thing to do with the Secret RF, and what are your tricks with it?
Sure. I mean, we have done entire face, neck, stretch marks, acne scarring, ice pick, box guard, different types. And if I had to pick one, it would be really difficult.
Dr. Manu Agarwal is a board-certified and aesthetic laser certified family physician specializing in vein disease. She founded the Vein Care Center Laser Specialists in Lima, Ohio, and is also an associate professor at Athens College.
It's just because everyone that we've treated loves their results. We haven't had one dissatisfied patient, and we've probably treated close to 75 patients since we've acquired the device earlier this year. I would probably say most satisfying probably is the acne scarring, because a lot of the patients have lived with acne scarring since they were in their early 20s. You know, they grew up in that era where it was okay to have acne, and you just kind of went through it. And if you ended up having scars, you just, it was just a part of life. Nowadays, we're seeing more adolescents not being acceptable of acne scarring, which they shouldn't be. We have technology such as this to address it. So I think the scarring is probably the most satisfying, because a lot of these men and women in their 40s and 50s have lived with it their entire lives. And it's pretty life-changing for them when you're able to smoothen out the skin, as well as reduce some of the wrinkles and give them all the textural changes that they used to have when they were little. So that's probably the most satisfying. I think pearls for me, it's the number of passes. So we try to maximize the number of horizontal and vertical passes on each patient, with the endpoint being some significant erythema, some pinpoint bleeding. And, we're doing 3 to 4 passes on every single patient. Most of them can tolerate at least 3 at different depths. And like you and Adriana mentioned, we do use some post-procedure care. We actually use some silicone-based wound healing. So we use the epidermal repair cream from a skin line that we carry in our practice. And it has an ingredient in there that has been shown to be helpful in wound healing and epithelial repair. So we use that. And a lot of our patients find themselves to be dry after the treatment for the first probably about a week or so. I myself had the treatment and I was pretty dry for about a week. So we try to use good hydrators that have some ceramides in them, tend to be a little bit thicker, again, using some of the skin lines that we carry in our practice.
Thanks. No, those are some really good tips, Manu. One of the questions I had for you, though, was, I've seen some of your before and after pictures with stretch marks. And look, there's nothing up till now that really does a good job with stretch marks. Can you tell us a little bit about your technique? Because the improvement you've shown with stretch marks has been really quite remarkable.
Yes, we were pretty excited with those results as well. When you look at historically with stretch marks, you have, the efficacy, like we all know, of topicals are really unknown. They haven't been really proven very well. The physical treatments of massages and topicals, that, none of them have really shown any efficacy. I think there's probably one literature-based results that did show benefit with microneedling radiofrequency devices. So with the Secret, what we do is typically use our 64-pin semi-insulated. For the particular one that you're speaking of, we did 3 passes and we kept it at 3 millimeters in depth, horizontal, vertical, horizontal. And then I actually switched the tip to the 25-pin semi or non-insulated to actually get some of the textural differences that you saw in that before and after result. And usually I'll try to combine the semi-insulated and non-insulated tips to give me both the dermal changes that I would like to see as well as the epidermal changes, especially with stretch marks, because we know, the pathophysiology of stretch marks where you have, linear dermal scars in the deeper in the layers, and then you also have some epidermal atrophy. And so by combining the semi-insulated and non-insulated tips, I feel like I'm able to address, all the layers of the skin and give the results that you saw in that before and after.
Dr. Fife commented that he uses Secret RF to treat hypertrophic scars with noticeable improvement. This prompted Dr. Sue to ask Dr. Bhatia about his use of Secret RF.
One of the places I've really enjoyed using it are more delicate areas that have a more kind of a longer recovery time with fractional CO2. So eyelids, I love eyelids because, as we know, the eyelid is one of the areas on the body where the skin is really just intimate with the underlying muscle. And so we can take advantage of this and actually deliver heat to the muscle right below the skin and actually cause some tightening effect, which really shows pretty quickly and readily. And my patients have been thrilled with what we can do as far as smoothing out the fine lines and wrinkles below the eye and on the lateral orbit. And then and I've seen some of your patients as well that have had just really remarkable results on that upper eyelid too, when people have that crepey skin. And I would say my tip here is to really, use kind of a moderate energy, about 60%, but then go three passes at 3 different depths. And if their skin is really thin around the eye, then, I'll do about 1 millimeter and then 0.7 and then 0.5. If they have slightly thicker skin, then I'll actually go to about a 1.2, 0.8, and then a 0.5. And usually within 1 to 2 treatments, patients really see a pretty amazing effect. The other area I like to go to with it is another area that we are cautious when we're treating, and that is the neck and anterior chest area. As we know, the sebaceous gland density and the adnexal structure density is lower in these areas, and so traditionally they've been a little bit more prone to scarring after CO2 laser and other aggressive treatments. But here, you can go in and deliver a treatment at different depths and, really just go over that area and do it really safely with very little downtime. And so that's another real go-to for me is being able to do very nice treatments in the neck and anterior chest.
I was wondering, Ashish, when you're treating the eyelid, are you placing eye shields in order to treat the lid itself?
That's a really good question. So when treating the eyelids, it's really nice because you can do this without actually using eye shield. When we treat the lower eyelid, we go ahead and palpate and feel where the orbital rim is. And once you've kind of located that, all we do is we actually stretch that skin, down from kind of the lid cheek junction and pull it down so far that you're actually pulling that skin over that bony orbit, and have the patient look up while we're doing the treatment. And then you can treat that lower lid very safely. Now, for the upper lid, we do the same thing. We actually kind of pull the skin up from the eyebrow and pull superiorly over it on the forehead. And that stretches out that upper lid skin over the bony orbit. Now, the part of the eyelid that actually covers the eye, that we do not treat. And I don't know if anybody else has that experience, but we actually avoid treating that because otherwise you'd have to place quite a bit of pressure on the globe. And if you did choose to do that, you would probably use an eye shield anyways. But we haven't really found necessity to really treat that because most of the patients, they're concerned about kind of the laxity between the brow and the lid, and the laxity and crinkliness of the skin on the lower lid and lateral orbit.
Well, thanks, Ashish. By far my favorite treatment, just like Ashish, is using the Secret RF to treat especially upper eyelid hooding and laxity. I find that some of the results in some of the cases really approach that of surgical blepharoplasty. But I think the key, though, is that you have to be aggressive. I am using, just like Ashish, using about 3 passes at 3 different depths, and I extended post duration with each pass. It will give a fast result. That is a fast treatment with impressive results. And to your point, Manu, about the eye shield, I think I agree, Ashish. I don't think I need to use eye shield at all. I think using the maneuvers that you described is perfectly fine. This is not a laser, so we don't really have to worry about the light kind of reflecting off the bony structures into the globe. Just as long as we are understanding that the needles cannot be pressed into the globe, I think we're perfectly fine. Manu, do you combine platelet-rich plasma with the Secret RF?
Yeah, so it's great. We wanted to add PRP to our practice, and it didn't make any sense without having either an ablative laser or a microneedling RF platform. We offer patients a microneedling RF package. With the Secret is we combine 1 PRP treatment within the package. There's good literature to support topical application of PRP as well as injection PRP, and so you can do either one. There's great literature to support it. We do have one great before and after acne scarring with boxcar scarring that we actually did topical PRP after the microneedling, and she had amazing results with just 1 treatment.
Amazing results with just 1 treatment. That's a strong endorsement. In our last episode, you learned what Secret RF is, and now you've gained insight into why leading physicians use it in practice. Next time, we'll explore how the experts optimize radiofrequency microneedling with Secret RF in their practices. To learn more about Secret RF and how it may fit in your practice, visit Cutera.com.